start talking because it's quite a tight shot.
Hello, welcome. Hello. They've put a little railing round that scare. I scared myself. I wasn't feeling safe. They've put a little railing round that scare. I can't believe how much love they are giving us. I'm struggling to find the words. 2 or 3 days ago, I was crying. A young lady came up, sat on the bed, held my hand. The surgeon saved my life. They wrote the draft, but here they are polishing the sentences. What they do is just as important. Life givers, all part of the same clock. So hard-working, so kind. As you get older, you get more sympathetic with life. In here, they aren't old enough to have that experience, but they do. They have such a wonderful quality. I'm still rebooting. There's something going on up there that I'm not familiar with, but it's still me, another version of me. I'm understanding it, accepting it. That's how you get well. So that's a verbatim poem that was created by writing down words spoken to me by a patient in one of the wards in the hospital, who's given their permission for me to share that poem, which they've put a little railing around that scare. And I'm the poet in residence at the Trust, and what I do is I go around with my typewriter, which you can see over there, or hear it later if I'm doing some typing. And I speak to patients and staff and relatives and carers in the wards, and in waiting rooms and foyers, and I listen to what they say and then write down what they say as poetry and offer it to them for any changes or revisions to make it their own, and then give it to them to keep and do with it as they wish. And sometimes people give the poems to relatives or keep it for themselves, or they might give it to a member of staff. So that's what I do, and I'm very privileged to do my work. I just can't really believe it, and I'm just so lucky. So and then this next poem is called My Front Porch is a Nesting Box, and this was written with another patient, and I said, is there something you particularly want to get across to the people at the event? And she was like, I just want everyone to recycle more, so if everyone could recycle more, that would be great. My front porch is a nesting box. She says, I'm wasting time as far as I'm concerned. She doesn't like waste, recycles everything she can. She wants to be back in her garden where the snowdrops are already out, the cherry tree in blossom. She grows the cherries for the birds. As a child, she'd take cuttings and give everyone a rose bush for Christmas. Now she plants a tree for anyone who dies. 3 good friends in the last 6 months. The birds winter in the woods, but they'll be back, she says. My front porch is a nesting box. She tells me, everyone should think of a tree that they'd like to plant. Her words are a nesting box. These cuttings are your future roses. So thank you, and I'm really looking forward to creating poetry with you later and seeing what beautiful artwork you will create. So have a lovely evening, and see you over at my table later.
Thank you ever so much, Beth, for kicking off this evening that way. And thank you and welcome to everyone for coming along as well. So whether you're leading an activity, joining an activity, or just here to find out a bit more about the arts programme, thank you ever so much for sparing that time. I shall quickly introduce myself. So I'm the Chief Financial Officer or Director of Finance for the organisation, but I also get to call myself the Arts Champion. So I absolutely love being able to call myself Arts Champion rather than Director of Finance, because it gets much more interest from other people. And I'm going to go back in a moment and tell a bit of the story about the investment the Trust has made in the arts, and more importantly, the fantastic support from the Bristol and Western Hospital charity. But first of all, I've got to do the housekeeping. So I need to tell you all that this evening's being recorded, so we ask that people please don't record or take photos with your own gadgets. As we get into discussion later on, we need to make sure that we don't talk about any individual patients or individual experiences. We need to sort of talk about some of the services in the round, so people could please be mindful of that. Towards the end of the session, we're going to make sure there's time for questions and answers, and whilst I might sort of stand up and try and facilitate that, I don't imagine for a moment you're going to be asking me questions, but the chance is there to ask everyone taking part in the evening. We don't want people to feel rooted to their seats at all, so there'll be sort of lots of opportunities when people are moving around, so please make sure you are comfortable. And I have to do, the toilets are out there on the right, and we're not expecting any fire alarms. So let me go back then to, I'll say, a bit of the history. And first of all, I wanted to mention Robert Woolley. So for those familiar with the Trust, people will remember Robert was Chief Executive until 2 years ago, and Anna Farthing, who was previously our Arts Programme Director. And from my perspective, a lot of what you'll see today is really built on the foundations that those two set in place a few years ago. And Robert, as a Chief Executive, was a real advocate of the role that art could take in healthcare settings. So my original involvement was very much as the Director of Finance, and really being persuaded by Robert and Anna that the Trust should invest some of its resources in the arts programme alongside the investment that the charity was making, and also the income generation that the team do themselves through one of the products that you'll see later on. And coming in cold as the Chief Finance Officer, I must admit to some scepticism in terms of how on earth is this investment going to compete against the many other things that people are looking for across the organisation. But personally, I was very rapidly persuaded. So when I sort of started to understand the impact in terms of not just patient experience or patient well-being, but this was really having an impact in terms of the health outcomes of patients, how long they were staying in hospital. So me, with my narrow financial lens, I could see this was in our interests. And furthermore, it wasn't just staff experience, staff well-being. I really believe that some of the programs underway are having an impact in terms of the recruitment and retention of our staff. So when Robert retired a couple of years ago, when the role of Arts Champion was up for grabs, I really wanted to grab it, and so I did grab it. But I still quite often get at least raised eyebrows in terms of what's the Chief Finance Officer doing. So there's obviously not many Chief Finance Officers have any sort of human emotion within there. But like I say, I love having some involvement. I don't think for a moment I could do justice to the Arts Champion title. But I do get to talk to my fellow CFOs around the region, around the country, and I have that opportunity to sort of advocate in terms of, I think this is a really important area of investment. So I do try and fly the flag in an area where clearly there are people with influence in terms of the decisions organisations are making. So I wanted to sort of share that in terms of my personal background. But in terms of getting on then with the sort of main events in terms of what we're here to do. So as you can see on the tables, lots of opportunity to sort of get involved in creative activity if that's something that you want to do. But also we're going to hear about a number of the specific projects. So Dance for Dementia, which was runner-up in a national award around environment of care. And this will show the impact we believe it has in terms of patient mobility, enhancing patient mood, and back to a point I made earlier, patients getting out of hospital and back home sooner. We're going to have a look at the fantastic resource packs that are used to encourage patients to sort of have something to do during the day, have something to think about, so try and get away from some of the inevitable boredom in terms of being in a hospital bed for a prolonged period of time. But firstly, to talk about the work of our musicians in residence who provide weekly sessions across the organisation, including in intensive care. So that's where we're going to go next with a film about their work.
Thanks everybody. Hi, it's lovely to be here. Thank you, Emily, and the rest of the arts team for the invitation. As Neil said, we've been involved in the arts programme for a long time, and I'll come on to the breadth of it in a minute, but just a little bit about us first. So we're the official hospital charity partner of UHBW, so we support all 10 hospitals in a huge range of ways, from little things like arts and crafts materials to a new clinical research facility in the Children's Hospital. So it's kind of anything and everything that's above and beyond what the NHS can do, and we're really privileged to be part of that. And as I've said, the arts programme is increasingly a part of what we do. So we've got 3 really big programmes of work that we look at. One's older care, one's health inequalities, and the third is arts and green spaces. And right from the very start, as Neil said, when Robert introduced the idea, we funded Anna for her initial kind of setup of the programme, and it was just Anna to start with. And it was so impactful and so brilliant. There was clearly a need for it, and we were so thrilled that the Trust also were seeing that in all sorts of ways. So over the course of that, it's expanded, and there's all the arts. I can see the arts team here today. It's a big team now, and we're so privileged to work with them on a huge range of projects. And I'm just going to pull out this one here in the middle. So this is an example of a really big project that we fund. This is the new paediatric clinical research facility, which was a whole new ward, if you like, in the Children's Hospital. So that's kind of at the massive end of what we do. And we commissioned an artist, and the theme was Under the Sea. It was done with the involvement of children and young people. And the feedback already, and the facility's been open just a few months, is just amazing. I see Linda here, who organised all this. Just an amazing job, really beautiful. And it's just testament to what we can achieve together, because this is so much more than really the NHS, UHBW will be able to do. You know, the budget needs to go elsewhere. This is where we can really step in, and it's such a privilege to do it. So we do it through working groups, so we work really closely together, often Emily and I, on a working group for any project where we want to improve the space. So often the care is incredible here, but the environments can be a little bit older, a little bit sad. And we know what a difference it makes to have a really beautiful environment, and it can really make a difference to the mood, to anxiety levels, to comfort of friends and family coming in as well. So there's a whole kind of strand of work around improving spaces. Then the other part of what we're able to fund is Beth, I see here, I see Joe here, and the beautiful video there showing the musicians in residence as well. And so that's that kind of performance element of art. So it's really the whole kind of breadth of what an arts programme could be. So it's funded through any number of different ways, different projects. And last year we were able to spend around £100,000 through different components, which is incredible. And it's something that we know families really resonate with as well, because and you heard the families talking in the video there. So it's not just the patients that it's helping, it's the families as well that come in, and also the staff. So just an absolutely brilliant programme to be part of. I'm not going to take any more of your time because you're not here to hear me, you're here to do these wonderful activities. But thank you all. If you've got any questions about the charity, about the programme that we run with the arts team, do come and find me. I'm more than happy to talk about it. Thank you.
I'm Frances McCallum, I'm the head of the arts programme here, and I just want to say a massive thank you to Neil for being our arts champion. Who's more perfect than the man in charge of all the money, really? And to Sarah and the wider charity for all of their support, for all the work that we do. We can do so much with your support, so it's incredible. And thank you to Beth for kicking us off with your beautiful poems, and thank you to Mike for the piano playing, welcoming us all here. Hopefully you kind of appreciated what a difference piano music can make to your experience of coming into this space. You may have been in here before, but just having that music kind of puts you in a different frame of mind. And that's the experience our patients will get on the ward when, our musicians, or Beth with her typewriter, all these different, and Joe, our visual artists and residents, come into the wards to create those environments and the experiences for them. So I am part of the Arts and Culture team, which is Emily as our Arts Programme Manager, Linda as Arts Programme Coordinator, Lou Arts Programme Coordinator, and Sarah Arts Programme Assistant. So we're quite a small team, and we've got all 10 hospitals in the trust under our remit. So that's a lot of buildings to deal with and many, many, many patients. I think there's something like 1 million people come through our front door every year. So we're kept busy, to say the least. Neil and Sarah have kind of given a bit of a background as to where we started. So the programme kicked off in 2018, led by Anna Farthing, funded by the charity as a pilot to begin with. And then over the years have now expanded to the team of 5. We're permanent members of staff here, funded by NHS money, with an NHS budget, and heavily supported by the charity. So our remit is to deliver the arts and culture strategy, and we do that broadly across 3 areas. Let me just do this. So we do that across partnerships, people and spaces. So the partnerships, we can't do what we do in isolation. So that's internal partnerships with our ward-based colleagues, external partnerships in education, cultural partners, a whole range of different partners to enable us to do brilliant and fantastic things. And then spaces. So Sarah spoke a little bit about the clinical research facility, paediatric clinical research facility. So we do those kind of big environmental changes, redesigning a space, commissioning an artist, but we also do much smaller things of putting up artwork in windowless spaces. So just a few £100 can make a real difference in a ward, for example, that has no windows, putting up kind of a picture of nature. There's so much research and evidence of the benefits of biophilia and what that can do to your well-being and improving recovery times. So that's just one of the smaller things that we do. And then people. So this is the main thing we're here to talk about this evening. So we focus a lot on our staff and our patients. I think partly because we came together as a team during the pandemic when it was, it wasn't a great time for anybody, and we weren't able to go onto the wards in the way that we wanted to, so we focused quite a lot on our staff and their well-being, and we've continued that programme of work, which is hugely important. There's boundless evidence about the circle of care. Staff who feel cared for are able to provide better care to our patients, so it's a win-win situation, really. And then in terms of our patients, I would love to be a patient here for the experience, the quality of care and the opportunities available. I mean, nobody wants to be a patient here, obviously, but the opportunities available are fantastic. And Emily's going to speak a little bit more about that.
Thanks, Frances. So I'm going to talk through a couple of examples of how we use creativity to enhance the patient journey here at UHBW. Since 2022, we've collaborated with North Bristol NHS Trust to run a Dance for Dementia programme. The programme's delivered by a dance organisation called Original Spinners, and the Original Spinners dancers visit our hospitals twice a week across 6 elderly care wards. And the dancers go onto those wards with music and an amazing bespoke trolley that we've got here today and props. Feel free to have a look at the trolley later in the taster sessions. And they engage our patients in movement and dance. And what's great about the Original Spinners is that they do it, they meet the individual patient's needs and levels. So for some patients that might be merely just observing the session from their bed. For others it might be getting them out, getting them into a chair and tapping their feet along to the music, while others will use the props and follow the dance moves. What's great about dance as a creative activity is that it can be an entirely non-verbal activity, which for some of our patients living with dementia, that's absolutely vital. And the staff on these wards are seeing huge improvements during and after these sessions from increased movement, improved mood, less aggression and less confusion. And then another activity that I wanted to highlight was the creative resource packs that both Sarah and Neil have already mentioned. We've also got a table at the back. Rachel's holding one up. Please go have a look at the resource packs. There's some activity sheets that you can take away with you. So we create seasonal activity packs, and they have a number of different, very simple creative activities and resources for patients to do while they're in hospital. Staff can ask for these on behalf of patients, or patients can ask for them themselves. And these activities help to alleviate boredom, they help to keep minds active. We've seen that they're great conversation starters, conversations between patients and their visitors and staff members. Because they're seasonal, they reference what's going on in the outside world. And for some of our patients, particularly our long stay patients, that can be really important. And we know that there is a need for these packs, purely from the sheer volume of requests that we've had for them since the charity very kindly funded these packs. We've had over 1,500 requests since September. And then lastly, I wanted to talk about our artists in residence. We are incredibly lucky to have 4 very skilled, very experienced artists on our team. You heard some of the amazing feedback that we've had about our musicians in residence work in the film that Neil played earlier. So our musicians, Tamsin, Elliot and Bethany Roberts, visit our hospitals once a week. They go to a number of different inpatient and outpatient areas. And then obviously you met our amazing poet in residence, Beth, earlier, and heard a little bit about how she very skillfully and sensitively engages with our patients through poetry. But we also have our amazing visual artist in residence, Jo Sinclair, who we've already pointed her out to you. Jo's been on our team since October, again, since the charity very kindly funded her post, and is already a vital part of the programme that we're delivering. Jo is with us 1 day a week, and she comes and engages patients on a one-to-one or a small group basis in a range of different departments and wards, and engages patients in creative activities that bring a bit of joy and a bit of distraction to what can be sometimes very long, often very boring, can be quite stressful visits to our hospitals, and we're incredibly lucky to have her. And the kinds of activities that she might do, from watercolours to origami, these are the kinds of activities that we'd like you to try out tonight, along with some poetry with Beth and having a look at some of the other activities that we run, to get a sense of what we do and the impact that it can have, and also to get your feedback. You know, what could we be doing better? What else could we be doing? But before then, I'm going to hand back to Francis, who's going to tell you a little bit more about the future of the programme.
So the future of the programme, well, more of the same, please, because there's so many wonderful things going on. And so our musician in residence, we've just had a pilot year of them, and we're planning to continue that, and all of our other wonderful artists in residence. We're also looking to strengthen our partnership with North Bristol Trust Fresh Arts Programme. We work quite closely together, but as our 2 trusts are now in an acute provider collaborative, I think I've got that wording right, we're looking at how we can strengthen that partnership. So Donna Baber, who runs the programme there, and myself are going to review everything and develop a joint art strategy together to implement in a couple of years' time. And one of the big things that we're intending to do this year, which feeds into the kind of theme of this evening of patient experience, is the physical journeys our patients and staff take through our hospitals. So we're going to look at the welcome and the journey, so the main entrances and the public routes through the building, Some of the hospitals are better at this than other hospitals, and we just kind of want to readdress the balance and make sure everyone gets that same kind of visual positive welcome coming into any of our 10 hospital buildings. And we know that artwork can massively support wayfinding as well, because it's quite disorientating in some of the buildings. We often, as a team, walking around installing an exhibition or with one of our artists in residence, find patients standing there with their letter saying, "Where's B217? I don't know where I'm going." So anything we can do to help lessen that would be a good thing. Thank you so much for listening to us all, kind of giving this introduction. But for now, I'm absolutely delighted to introduce you to our UHBW staff choir, led by the fantastic Ellie.
Jolene, I'm begging of you, please don't take my hand. Jolene, Jolene, Jolene.